love spending time with patients and clients. And one of the things that has fascinated over the course of my career is our ability as human beings to know that something's not quite right and then to wait until we do something about it. My name is Dr. Dunay, and I'm an audiologist and counsellor at Cotton Tree Audiology here in the beautiful Sunshine Coast in Australia. Why do we wait? When the car is rattling, why do we turn up the radio instead of seeking out the help of a mechanic? Or if we feel a sharp pain on the one side of our jaw, instead of phoning the dentist, maybe just spend some time chewing on the other side for a while until treatment becomes inevitable and rather painful. One of the most striking examples of this can be found in hearing healthcare. Did you know that despite all the advantages of having good hearing, the progress that has been made in technology and all we know about hearing loss, and even how frequently it occurs in our populations, that it takes between 7 to 10 years for someone to seek out a hearing test? So from knowing that things are not quite right to actually seeking help is going to be 7 to 10 years on average. So why is that? The books tell us and throw around words like ambivalence about treatment, or that people are in a phase of pre-contemplation where they think it's not a big deal, or contemplation where they know there's something wrong, but the benefits of seeking out help is still not quite outweighed by just maintaining the status quo. Or sometimes words like denial are thrown around. And I think we need to really unpack this phenomenon because it happens so often and so frequently in hearing healthcare that I think it deserves some attention. So some of the reasons that people actually have from knowing to doing and maintaining that massive gap in time is that they would say, I have too much going on. There is just too much going on in my life now to attend to this. And to this, I think I want to advise or provide an insight by stating the following. There is not a single situation that is improved with poor hearing. Not speaking on a phone, not attending a critical meeting, not being in a group, receiving medical treatment, having to obtain informed consent, for example, a medical procedure. Not a single one of those situations benefit from poor hearing. Indeed, what we know about healthcare is that regardless of someone's hearing levels, at least 50% of what is said is forgotten immediately. And of the 50% that is retained, 48% of that is remembered incorrectly. So verbal information obviously needs to be followed up by written information. But part of that too is that we want to give ourselves the best possible opportunity to make sense of our own healthcare in that situation. So there isn't a good time for poor hearing. Another thing I often hear is that lovely clients and patients put the needs of others first. I often hear, well, I first need to help my wife through this COVID bout that she had, or I am helping out with the grandkids now, and there are lots going on, and I just need to put some people's prioritize their health above my own, which is really lofty. But here I want to say that it's important again to recognize that if anybody in a conversation has an untreated hearing loss, everybody in that conversation is going to have a hearing problem. Okay, so when we're looking at other people's needs, one of their needs would be for you to optimize your hearing. It is an act of service to others. Because let's look at what happens when someone has a hearing loss that is untreated or poorly treated. They often require a lot of repetition of what is said. There's often some complaints coming their way about devices and phones and televisions being a little bit too loud for the rest of the group. We often also notice that people would be asking a lot of questions to clarify and keep track of what is said. So there's a lot of dominating of a conversation through question asking. Many people fake understanding and just nod and smile because they don't have the heart to ask for repetition again because they didn't hear that. Heartbreakingly, people start avoiding certain situations and activities that they used to enjoy, but it's just too hard to try and decipher and listen and participate in that. And then we see withdrawal from life and from life's enjoyment. And that certainly not only impacts the person with a hearing loss, but also the people around that person who now have a hearing problem. And so what does that hearing problem look like? It often is a person that is required to repeat a lot of what they have to say, that have to rephrase things they say in a simpler way or in a shorter way to ensure that they communicate that easy. It's someone who has to check understanding all the time to make sure that the person they're speaking to is following along. So what we see from both sides, both a person with an untreated hearing loss and everybody in their life that has a hearing problem, is a lot of fatigue by the end of the day. The quality of the conversations also drop down because we're trying to get to the point quickly because we're repeating so much. And then the quantity of the conversation also reduces to get to the point as quickly as possible. And here I also want to make a point in talking to healthcare professionals. If you're a physician or a nurse or an allied health practitioner and you're trying to communicate with someone and communicate critical information, but they are not hearing you properly, it puts a huge burden on your communication to ensure that they're following along. Hey, so when we look at hearing and deciding what to do about hearing loss, we want to retain and improve and recapture all that texture and nuance that is typical of our communication. The third reason people often decide not to do or take action about their hearing problem is they have heard someone else's horror story about what happened to a spouse, an aunt, an uncle who had a hearing problem, and they went and they spent all this money on a hearing aid and it ended up in the bedside drawer. A horror story. So something about being forced or pushed into spending money on something that they didn't quite feel they needed or wanted, and then still not getting the benefit from that. So this is a very serious concern, and unfortunately this is a very, very frequently occurring conversation. So I think here we have to look at it slightly differently, and the insight I want to provide here is to say we need to move beyond looking at improving hearing to improving communication, to restoring the enjoyment of sound, and to look at safeguarding our ability to locate alarming sounds in our environment. And so we need to look at improving communication. Part of improving communication would be to look at their hearing loss and managing that. And that's the part where technology becomes really important. But I would say that technology is an essential part of a communication improvement plan, but it is not adequate to address what needs to happen for you to have improved communication, an improvement in your enjoyment of sounds in nature and your environment, and also to have the safety provided by good hearing levels. For that, we need to look at least 3 or 4 other aspects, including your speaking habits that you have developed over time. We need to include your listening and speaking partners in the process, because it's critical to learn to use this new technology and devices and this new way of being in a better way. We need to look at your environments. Where do you have real strengths that we can capitalize on, and where do we need to work a little harder to ensure that you get a good outcome in that space? And the fourth bit that is so important here is we need to practice. It's not a one and done. It's not put a device on and off you go and things are better. I mean, look at the size of some of this. This cannot solve every communication problem that you've had. What it can do is make sounds audible and clear and balanced. And then the rest is up to you and your clinician to work out and work together for a good outcome. So to summarize here, what do we do? What do we do? How do we approach this? And I've got some suggestions here for you to get that process started. The first thing I would do is just quietly reflect on what I'm hearing and what I remember hearing that I don't hear anymore. And just have a reflection on that, okay? What am I hearing in terms of communication, and where am I struggling? Are there sounds in nature that I used to love and that I don't have access to anymore? Have I become a little hesitant in going out and figuring out the traffic or the honking horns because I'm not quite sure where sound is coming from? Okay, have some time to think about that. The second option or recommendation I would give is talk to at least 3 trusted communication partners in your life. People that will tell you the truth with kindness about what it is like for them talking to you. And also, what environments have you started restricting yourself to because of a communication issue? So you have what you know, and often we benefit from seeing how other people see us from the outside. The third recommendation I would make is to do an online hearing test. A self-test in the safety of your own home so that you can put your toe in the water and see how the land lies. Visit our website, for example, at www.cottontreeaudiology.com.au, and you can access a hearing test there just to see how you go. And after following those steps, give yourself 3 to 5 days and make an appointment. It's time to get excited about hearing again. Thank you.